John, good morning. Dr. Samadi here.
Good morning, Dr. Samadi.
So, of course, this is a big topic, and every one of us as physicians, we have our own stories. As a urologist, I write for a lot of medications such as Viagra, Levitra, Cialis, and the patients always complain. I went to my insurance company. They gave me 3 pills. I've been paying for years, and now that when I need the drug, they throw 3 or 6 pills at me, and then they say, if you want more, each Viagra pill would be $45. And one of them actually said, you know what, it's not even worth having sex with my wife for $45. So in the recent event with this company that raised the prices so high, what's going on in this country? And, how do we prevent this or stop this madness?
Well, there are multiple dimensions to it. As you pointed out in your introduction to this topic, the industry does make large investments in research. It is costly and time-consuming, and all of the things they discover are not successful, and often they have to write off large amounts of money. However, although I think this does justify the need for profit and perhaps profit above the average industry, there are limits. And when you analyze the profitability of the pharmaceutical industry, it's extremely good and getting better. So I think it's a fair topic to say, why are the prices rising so fast when other aspects of healthcare have lowered to single-digit growth? Pharmaceutical drug prices are in double-digit growth. There are a lot of reasons for this, but I lay the primary cause at the feet of Congress. As you know, the Prescription D drug plan was introduced some years ago under the Bush administration, and a provision was inserted in that legislation by Congress that prevents Medicare from negotiating the price of the drugs they pay for. Well, back then, Medicare maybe was a small customer of hospitals and others, but now it turns out that it's quite large.
One of the biggest players, right?
2/3 of the revenue comes from Medicare.
Sure.
Yeah, so that's really the root cause. If Medicare could negotiate the prices like Medicaid does, they would save hundreds of billions of dollars. The cost of drugs would be lower, and private paying insurers would tend to demand the same level of pricing.
So that's a very good point that you're bringing up, and I think hopefully Congress will do the right thing, even though I'm not very optimistic.